What is the best radiofrequency treatment for delicate eye area? Hi there. I'm 42 with olive skin and not a lot of wrinkles, but definitely some developing around under my eyes, and just some thinning of skin in the area in general. I'm interested in doing a radiofrequency procedure, and I'm going between Pelleve and Thermi. Is one better than the other for going into the delicate eye area? Can either be used on the top lid as well? Is there more risk with Thermi because it can get hotter? Thanks.
Thank you for your question. You've submitted a question without a photo, but in this question you describe yourself as 42 with olive skin and that you're developing some fine wrinkles around your eyes. And you're trying to decide which radiofrequency device you want to have for this problem between Pellevé and Thermi. And you're also asking about whether the procedure can be done to the upper eyelid area, and you're asking if there are greater risk from Thermi because you believe that the Thermi actually works in a way that the temperature is hotter. Well, I can give you some guidance as to how I answer questions like this in my practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I have used technology for skin rejuvenation since the early days of the original CO2 lasers back in the early to mid-90s, and the evolution of different options has grown to a significant level, and ultimately is causing certainly a lot of confusion amongst people who want to solve the usual issues that concern people with facial aging. So at 42 and with olive skin, you are probably have already learned that ablative devices where the laser is used to remove skin may not be ideal for you because of the potentials for risks related to pigmentation. But I find it interesting that you're phrasing the question, what is the best RF for the fine lines under your eyes? It's assuming that radiofrequency technology is the only solution for the under eye wrinkles, and you're looking for the best one. Well, let's just understand what the concept is, and I'll tell you how I discuss with my patients the risks and benefits of anything, as well as what my global understanding I try to convey to my patients about what to do when they see fine lines. So let's start with what radiofrequency technology is. Basically, it is use of radio waves or radio frequency to convert energy from radio to heat. And with heat, you are inducing a certain target temperature in the skin to elicit a collagen remodeling response. And so essentially, the technology for inducing the heat, whether it's Pellevé or Thermi, and just full disclosure, I have Pellevé in my practice and I've had it for years. I can tell you that, and I don't have Thermi, I would say that essentially when you watch people doing either procedure, it looks pretty much the same. And it's because essentially it is the same. When you think about how manufacturers promote procedures and devices, essentially they literally bypass the practitioner. What I've observed with laser and technology manufacturers is that because they are essentially trying to create demand without using the real experience of physicians who are at the ground level treating patients and getting the feedback. So like drug companies that used to market to physicians about the benefits of drugs are now marketing directly to consumers. The same thing happens with different device and injectables and pharmaceuticals. And so people learn about these devices and feel like this is the best thing that could ever be, and then go chasing after the device and as a solution, as opposed to meeting with a qualified, competent physician who can give you perspective overall. So I would say that radiofrequency technology is valid and does have value. However, when I counsel my patients, I begin with first asking, what kind of outcome are you looking for? How do you define success? I begin with explaining that it is essentially impossible to eliminate all the fine lines. When you see fine lines, you have to understand there is multiple dynamics in what causes these fine lines to occur. But an important dynamic is simply the activity of facial movement. So when you think of the fine lines under your eyes, there are dynamic lines which occur when you smile and when you activate muscles, and there are static lines, the lines that are there at rest. Any type of device, such as a thermal energy device or a laser, is basically to treat static lines. What's the challenge? Well, the challenge is that those lines can still form because of the activity of facial movements. So very often I will actually counsel my patients on a multiple approach so that we do something such as reduce muscle activity with a neurotoxin like Botox or Dysport, use something to build collagen from underneath the skin, such as the use of PRP or platelet-rich plasma, and then consider also the use of a thermal energy device and even possibly even a limited ablative device, whether it's a fractionated erbium laser or using something to try to help improve the surface. When you think of under eye skin, this is skin that's only 0.5 millimeter in thickness. There are a lot of variables that affect how a person responds to any of these modalities. So when you think of these procedures, you have to also think, what kind of result will I ultimately likely achieve, and is it worth the time and the expense that I would be putting into doing these procedures? And and what I find is that people want very dramatic improvement, and they don't want to spend a lot of time waiting for that dramatic improvement. And I think that this is one of the challenges for a thermal energy device, whether it's one brand or another, because there is a certain amount of collagen that the body can respond with, but there's a certain limit every individual has. And then there are other factors that affect how much collagen is being generated. It's kind of the holy grail, is to stimulate the body to generate collagen. So I would say that your question should really, if I were to ask you to rephrase it, I would say, what's the best way to improve fine lines and wrinkles? And really, in your situation, and that requires really a proper examination and a real understanding of who you are, what your expectations are, and what kind of time frame you are willing to commit to, and understanding the different ways to treat this area and what kind of cost you are comfortable with. So this is why there's no one solution for one problem. There's multiple solutions, and it's the art of medicine that a physician who you can work with will develop a plan with you, and you work together on making these things happen. I always tell my patients that basically, besides doing surgical procedures, lasers, and all the other things we do, injectable fillers, I become essentially their primary care doctor for beauty, to guide them not only with solutions, but also to educate about what the latest device or fad is in terms of hype. If you just look back at the history of this specialty of non-invasive medical technologies, all you have to do is just look at what trended over the past 5 years at different times. And each time you'll notice there was a huge surge of interest in a new device. Essentially, these devices were very aggressively marketed, and then they faded away, and practitioners became disenchanted with them, and patients became disenchanted. So it's very important that you really think through these factors, and don't shop devices, shop the right physician. I think that's probably the take-home message here. So I hope that was helpful. I wish you the best of luck, and thank you for your question.